Namaste and welcome. I'm Dr. Rajiv Iyer, a pediatric anesthesia doctor. In this video, I will tell you how you can become a pediatric anesthesia doctor like me in India. Now the first thing obviously begins with going to school. Once you finish your 10th standard, then you do 2 years of PUC, which is called +1 and +2 in some places. In +2, it is important to have physics, chemistry and biology as your subjects so you can become eligible to go to MBBS. So once you finish +2, you take the relevant exam, enter MBBS. The MBBS training lasts for somewhere about 4.5 years. During the MBBS training, you learn a lot of different subjects. There are preclinical subjects and clinical subjects. And once you finish your MBBS training, you pass the exams, you do an internship, which is 1 year. Once you complete the internship, you are officially now a doctor who is eligible to practice medicine in India. Now there are 562 medical colleges in India, which produces a large number of doctors. So keep in mind, the training can be very variable depending on where you finish MBBS. Some places are outstanding, but some places are mediocre. So you have to keep in mind about that when you enter MBBS. Now once you finish MBBS, you become eligible to do training in anesthesia. For this, you have to take the relevant entrance exams. At least when I did, there was an exam for AIMS, there was an exam for PGI Chandigarh, there was an All India exam. So once you clear that exam and you get a good rank in the exam, you become eligible to go into anesthesia training. The anesthesia training lasts for 3 years. The training in anesthesia can also be variable depending on where you train from. Based on my knowledge, some of the excellent places to train in India are PGI Chandigarh, AIMS in New Delhi, CMC Vellore, JIPMER, and some of the top colleges in each state. Once you finish the 3 years of anesthesia residency, you take an anesthesia exam, you pass it, and now you're an anesthesia specialist. In order to get into a pediatric anesthesia, you again have to apply for places where they do pediatric anesthesia training. Now, pediatric anesthesia is an upcoming excellent specialization. This is because 30% of population in India are children. So more and more children will need anesthesia for surgery and many different medical procedures. Now after the anesthesia training, there are 2 ways to become a pediatric anesthesia specialist. One is you either do a fellowship or you do a 3-year DM course. The fellowship lasts for 1 year. This happens in standalone hospitals in Hyderabad, Bangalore, Mumbai, Chennai, and many other cities. Now if you want to do a 3-year DM course, there are 2 places where this is available. So one is PGI Chandigarh, which is a top-notch place, and the other one is KEM in Mumbai. So once you finish your training, you write an exam, you pass the exam, and now you're officially a pediatric anesthesia specialist. If you're interested to know how pediatric anesthesia is done, check this video out where I have shown how anesthesia is given to a 1-year-old baby. If you're interested in videos like this, make sure you subscribe to the channel. Take care, stay safe, I'll talk to you soon.